Hello, my name is Robert Tasker, and I really want to thank you for letting me be your editor-in-chief of PCCM in 2021. I've written two pieces for you. I think both are important and worth reading. The first is a foreword, which is mainly about our new impact factor of 3.624, a tremendous legacy that Dr. Pat Kahanik has left us with. I talk about the process at the journal. We currently have an acceptance rate of 7% and competition is tough. With that background, I talk about gender equity, young and new authors and how we should be helping them. I also talk about the value that the journal gives us all. 1/3 of all pediatric critical care medicine literature is published in PCCM. The other 2/3 you'll have to search in over 300 journals. So I try and make it topical. If we're missing something, we will have an editorial. And lastly, I just want to mention our new formats, and I've introduced another new format this month. So now to my editor's choices. The first article is by Jenislaw and colleagues who have looked at a data set of 45,000 patients in the Texas Medicaid data set and applied a technique called propensity score matching to look at an association between prior mechanical ventilation carried out invasively and later development of mental health disorders. This is a complex area and people could get carried away with the conclusions. So what I've added is a statistical note by a PhD statistician called Naomi Kreef, who has written a piece about propensity score matching. And we also have an editorial about causality and how one should think about that. The second article that I want to highlight is by Chowdhury and colleagues who have looked at the ELSO registry, 1,400 patients with myocarditis or cardiomyopathy, and looked at the issue of left heart decompression. I did ask two authors to write an editorial for me. It was so good that I've invented a new format, and I now call it concise physiology reviews. And so Puri and Adachi, beautifully illustrated article for us. Then the third article is by Brown and colleagues looking at census data and access to a PICU in 170 metropolitan areas within the United States. And lastly, for PCCM Connections, I think it's probably worth focusing on the outcomes reports that we've published in 2021. Well worth reviewing these and looking at these. So that's December 2021. I look forward to seeing you in January 2022. We have much more content and really many more new developments that we all need to keep abreast of. So thank you very much. This is Robert Tasker signing out for 2021.